So thank you all so much. I'm thrilled to be here. It's great to have a chance to talk to you all, and I really appreciate all of the support that you all provided for the research. So this is great. I also want to give a shout out to VetVine. They are the ones that have the link to the talk that your veterinarians can use for free, thanks to sponsorship through AKC and the Canine Health Foundation. They helped me with some of these slides, and they did such a beautiful job with them. I've reviewed some of them because their formatting is just fantastic. So I wanted to thank them for that. So pigmentary uveitis, and what is that? What do we know about it? What have we been doing in the research? And hopefully a lot of the questions you've had will be answered during the talk, because I've tried to incorporate that in our latest information, and then we'll answer more questions at the end. So just a little review so everybody's on kind of the same page, because we're going to talk about some of the parts of the eye to make all of this make sense. So this picture is not a golden's eye, because we've got now, hopefully everybody sees the husky with the beautiful blue iris. So we've got the iris here, that's the colored part of the eye that stands out quite nicely with the blue, and then the pupil, which is the opening back into the back of the eye. And so when we're doing the exams looking at the golden retrievers, this area is where we're doing a lot of the looking, because what you don't see right here is the lens, which is clear and sits right behind it, and is where the pigment gets deposited in pigmentary uveitis. And we've got pictures coming up that show that. One of the really big keys when we're doing the exams to get a good look in the eye is dilating this pupil. So that's why they'll get the dilating drops, and then you have to wait 20 minutes before we can finish the exam, so we can really open that pupil up and get a good look at the lens and be able to really look in the eye and look behind the iris. So when we look at this image, is this cutting off the top of the image for you all, or is that okay?
Okay.
Okay, perfect. So this is a cross section of an eye. There's no quiz at the end. You don't have to know all the parts, but the eye is looking over here to the left. So we've got the cornea, that's the beautiful clear front part of the eye that usually is kind of translucent, so you just look right through. The big areas to focus on, here's the iris again, that colored part of the eye. Here's the pupil, the space, and then the lens behind it. And then where this star is, this is really where all of the changes, or the big significant changes, are taking place with pigmentary uveitis. So this is a really difficult spot for us to look at during our exam, and is why we've done some of the ultrasound exams that we'll talk about later. So this is a really key area. When we talk about the cysts, we're going to talk some about terminology and parts of the eye, again, to try and sort out the uveal cyst versus an iris cyst versus a ciliary body cyst, because there's several different names out there that can often cause some confusion. So I got interested in pigmentary uveitis again during my residency, was when it was being described. So I know everybody has excellent goldens. This is one of the world's best goldens. This was my golden that I had going through vet school, and then when I was in practice and my internship and my residency, he did not have pigmentary uveitis, but seeing all the other goldens being affected and not having answers, was very frustrating. So it's important to know when we talk about uveitis, that is a really big umbrella term, and that just means that we have inflammation inside of the eye. And this gets important because golden retrievers can have uveitis for lots of other reasons besides pigmentary uveitis, and then that's very different. So we'll talk about some of those reasons. Whereas pigmentary uveitis it's an inherited condition. We see it only in golden retrievers or golden retriever crosses, and it's predominantly in the goldens that have the North American bloodline. So they don't really see it in the European or the goldens in the UK. So not all uveitis in a golden is going to be pigmentary uveitis. So we can see lots of infectious diseases cause problems. So it doesn't usually cause significant inflammation in the eye when we have pigmentary uveitis. And we don't usually see problems in the back of the eye. So this image, we're looking at the retina of a dog. We've got their optic nerve, so that's the cable that carries the information back to the brain. And then all of this tissue that's kind of waving at us like a veil is the retina. And that acts like the film in the camera and captures the image. So this retina is detached. So this dog has uveitis, it's got inflammation in the eye, but this dog has an infection with Rocky Mountain spotted fever. So, you know, if we see that in a golden, you know, and that's why it has the uveitis, that's not pigmentary uveitis. That's an infectious condition that we need to treat. Or the image on the right, this is a golden retriever. So this dog comes in, it's got this little nodule here, the kind of hazy stuff you see looking through the lens. It's also blind because its retina is detached. So this is a golden retriever that's infected with a fungal organism that we see a lot in kind of the Midwest and through the southeastern United States called blastomycosis. So again, if you have a dog and a golden and it gets diagnosed with uveitis, that doesn't necessarily mean it has pigmentary uveitis. And in both of these cases, this is nothing genetic. This is all infectious. And then the same here. This is a dog that's got cancer. So we're seeing a lot of inflammation inside of the eye, and these are clumps of neoplastic cells or cancer cells sitting here. We've got some hemorrhage. So we could have a golden, because goldens have a lot of issues with lymphosarcoma or lymphoma, that can cause inflammation in the eye. Again, that inflammation is because of the lymphoma. So that's not, you know, that's not something that's pigmentary uveitis. So it's really important to sort those out. Again, same thing here in this eye. This is a dog that, you know, also has cancer. So we've got some hemorrhage in the eye and this clump of cells. So again, not pigmentary uveitis. And the reason I highlight that is sometimes, you know, owners will email me because they've got a golden retriever who's been diagnosed as having uveitis, and they're worried that it's pigmentary uveitis, and they're, you know, reading about that, and they're worried about breeding. And really it's, you know, it's in the same category, but it's different, because here we need to address the underlying cause. So we need to look at the infection that's there, or we need to treat the cancer. So it's really important to remember, not all uveitis is pigmentary uveitis. It's very specific. So then you go, well, how do you know when it's pigmentary uveitis? Like, how do you tell it apart? And so the distinguishing feature, the hallmark feature, the feature that has to be seen to diagnose them as having pigmentary uveitis is this radial pigment on the front of the lens. So this is our lens, and the lens is, if you imagine an M&M with a candy coating, it's got a candy coating or a capsule that's on it, that's the outer layer, and that's where this pigment gets stuck. So instead of being nice and clear like before, we've gotten these little radial lines. It looks like spokes on a wheel. That's the pigment that's being deposited. Here we have kind of a clump of pigment. These are a couple little tiny cataracts. We often will see those because they're areas the lens doesn't really appreciate having the pigment touch it, so we'll get little tiny cataracts associated with it. Or in this image again, all these radial streaks of pigment and some other little kind of spokes behind it. This thing that's not quite a complete circle that you'll see in a lot of the images, that's a reflection from the flash on the camera. So just ignore that when you see it. And this other kind of little shape here, those are my fingers reflecting, holding open the eyelid. So just, you have to kind of look through that part. Those are little extras that show up in all of our pictures. And so a question that's a very fair question that's come up a lot and been a big concern for breeders is, are all ophthalmologists, you know, grading and diagnosing pigmentary uveitis the same, or are people using different criteria? And so we wrote an article this summer. I was one of the authors, and then the genetics committee for the ACVO chairs of that all participated in. It's this article here that was published in our veterinary ophthalmology journal. This is one, if people want to read it, it's available free online. So the Canine Health Foundation sponsored making this an open access article. So anybody can click on it, read it. There's no charge. You can access it online. And we went through and talked about diagnosis, and for the OFA exams, what we want to see for ophthalmologists to make a diagnosis of pigmentary uveitis. And we've asked on the form, we can check the box, but then there's an area for us to make comments. And we've asked that the ophthalmologist, draw in and list the criteria they're using to make the diagnosis, because all of the forms, if there's any question, get reviewed by Katie Deal, who's one of the authors on this paper. She's an ophthalmologist at the University of Georgia. She's the liaison between the ACVO and OFA. So she'll review all of the forms. So now with this criteria in place, if they don't list the criteria, she's going to call the ophthalmologist and say, what were the criteria you used to make this diagnosis? We want to see the radial pigment. It doesn't have to go all the way around. It could be often really early. It'll just be kind of a little quadrant or a couple of clock hours, but that's the key feature that we need to see to make the diagnosis. And so, a paper that we wrote up this summer that's also available for free on the veterinary ophthalmology website. This one, the journal decided to make open access or free access, is one that I wrote with a student from Purdue. And we'll talk about this one more because we were looking at risk factors for glaucoma and losing vision. And so we created a scoring system. And so Gail Watkins had contacted me and said, hey, would it be okay if, we kind of wrote this out and people could take this with them when they go to their veterinarian or their ophthalmologist and they're diagnosed with pigmentary uveitis, to ask them to score it so they have an idea how severe it is. And so this is based off the scoring system we had. So you can see, they've got to have the radial pigment. They have to have. And so if they're really mild, then we can only see it when we have some magnification. Then as it gets, more extensive, it gets so you can't see through very well. And we'll talk about synechia, where I have pictures, but that's where the iris is getting stuck to the lens, down to where we start getting glaucoma. And then also we had scored kind of the number of cysts, and so they can score the cysts too. So I can share this later, and people can use this if they want to take it in, because that's a way to then, if you're wondering about the diagnosis or wondering how severe, this is a way to have that and see the criteria that they're using to make the diagnosis. And the owners who had taken it into their ophthalmologist said their ophthalmologists were like, oh, this is great, and we're happy to fill it out and mark things to be able to provide that scoring. So there have been some questions in the OFA Blue Book. There's the list of diagnostic criteria. The key one that we have to see is that radial pigment that we have the pictures of. The other things that we may see, but that aren't enough to make a diagnosis by itself, are seeing more pigment in the iris. And I've gotten some pictures of that where it starts to get darker in color. So that can be something that gets noted, but that by itself is not enough to make the diagnosis of pigmentary uveitis. The iris getting stuck to the front surface of the lens, we can start to see that happen again in the more severe cases. And then we can see cataracts forming as well. So those are, this is mainly just to clarify, some people had read those criteria in the Blue Book and were wondering if, kind of these bottom three were enough to make a diagnosis. Those are kind of extra, but the radial pigment is that big key. That's what we're looking for.
So Wendy,
hopefully,
ask one quick question. So are the iris cysts, are they incidental? Because that seems to be where everyone seems to start to see that they might have an issue.
Yep. So those are ones, I've got a couple of slides. It's a great question. I've got some slides coming up to talk about those because they definitely are quite important. And we'll talk about kind of the number that makes us more concerned and what we found when we followed individual dogs over time as far as a risk factor. So we'll definitely, I've got a lot of slides, and also talk about kind of their position and some of the different names they've had, because that's led to some additional confusion for people.
Thank you.
So that's a great point we'll be sure and cover. So when we talk about ages for pigmentary uveitis, 8 to 9 years of age tends to be the typical age for it to show up. We have a range of kind of 1.5 to 15 years. So 1.5 is quite atypical. And I've gotten some slides coming up to sort of show more of the usual progression. It's usually around 8, sometimes 6, very rarely kind of 4, and really unusual to be as young as 1.5. And then some dogs will be quite old when they get it. So they might be 12, 13, 14. Some of those dogs haven't had consistent annual exams. So if I look at 15 and they have some pigment, I don't know if they've had it a year or two or if it just happened. But, you know, some of them, this is one of the things that makes it quite challenging is if they're 15 and it shows up, you know, hey, your golden's 15 and that's fantastic and amazing. And so there's lots of great stuff there. And, you know, if they're fairly mildly affected at that point, that's great too. And so a very fair question that I've been asked before is, you know, hey, how much of a big deal should we make about pigmentary uveitis? I mean, Goldens have, you know, problems with hemangiosarcoma. They have problems with lymphoma. Like we have, you know, if they're getting to be 15, that's fantastic. So we have, you know, a lot of other very significant conditions to think about that absolutely are really important, you know, when you're making breeding choices. And if we could have pigmentary uveitis, so they didn't get it until they were 10, 11, 12, and it was mild and just little bits of pigment, that wouldn't be, you know, a bad thing if we could get it. And so we get that, because the times when it's difficult, and it's all a balancing act, the times when it's difficult are when we have Goldens who are really severely affected and they're like 6, 7, 8 years of age, and they're ones who get glaucoma and end up being blind in both eyes. So like I think of a little Golden who was a guide dog who was only 6 when she was affected, and she was quite severely affected by the time the diagnosis was made. And so she ended up being blind in both eyes. And her owner, because that was his guide dog, he was just absolutely devastated because he loved the dog and now she couldn't guide for him. Or you have an older dog, you know, like the situation I have with my Golden now, who has pigmentary uveitis. Well, he's in the middle of being treated for lymphoma. He's also developed glaucoma. So we're having to work to keep his eye comfortable for the glaucoma because he's not really a great surgical candidate at the moment. So, you know, that gets challenging when we get into the severely affected one. So that's why we're really wanting to be able to understand the disease better, be able to have, you know, provide guidance so that we can make really educated decisions about who's being bred and who's not, so we can decrease the risk and then, but not, you know, throw out good genetics that are in there. So the hard part is, though, it means that there's really no safe age. So I can't promise that, oh, if they made it to 10 and don't have it, you know, they're not going to get it. So that's why, you know, the lifetime eye exams are recommended. And when I show some of the data from SURF, it's really encouraging that people are doing that because we're seeing the average ages going up. So that's an excellent thing that's happening. Who gets it? It's all Golden. So it's either Goldens or Golden crosses. So usually the Goldens cross with lambs we're seeing in guide dog programs. And then with the popularity of the Golden Doodles and sort of the length of time that's been popular, we're starting to see some of those crosses also showing up with pigmentary uveitis. So far, males and females appear to be quite equally affected. So it doesn't appear to be any type of sex-linked trait. We also haven't really seen a difference in whether they're spayed or neutered or not, or whether they're intact males or females. The data gets a little bit skewed because a lot of them either are older when they're having their exams, so especially females have been spayed, or, you know, potentially they had either, because if they got pigmentary uveitis, they were neutered. So we see it skewing a little bit towards the altered animals, but it doesn't really appear, you know, we'll still see intact animals that are having it. So I don't think that change in hormone levels is causing differences in the intensity or severity of the disease. So one of the things that's really challenging with pigmentary uveitis is early on, there are really very few signs. There's not much that an owner is going to be able to see to know that the dog is having changes in their eyes. So these are two really mildly affected animals here. Occasionally owners notice a little bit of redness here in the conjunctiva, the little pink tissue overlying the white part of the eye. But that's something that'll kind of come and go. And then it's hard to know, well, is that, allergies, or especially if they're dogs that are, going outside and playing in tall grass or doing field work, whether that's the cause. So they don't usually squint. They're not usually doing anything to act particularly uncomfortable. And so these early stages where we tend to do better if we start treatment, it's really easy to miss unless they're getting screened. So it's a good reason to encourage, people buying puppies to do yearly screening exams, or at least screen them like every 2 years, starting around age 2. Before 2, whether they're going to get pigmentary uveitis or not, they're all are going to look beautiful as far as, not having cysts and, not having pigment. And the big key is, again, we want to do the dilated exam, because this pupil here, as it's dilated, we can see all the radial pigment. If it's not, the pupil's going to sit about here, and we're not going to be able to see that pigment. We're going to miss most of it. So they've got to have the dilated exam to see that pigment and make the diagnosis. So another thing that we look for, or if you've had a golden who's been affected that your veterinarian may talk about, is a thing that we call posterior synechia. So it's our big fancy word to mean that the iris here has gotten stuck to the lens behind it. And so that's this piece here. So now it's sort of cemented down. And the reason that that's a big problem is that starts to interfere with the fluid that has to flow in the eye, because the fluid's made back behind the iris. It has to come through the pupil so that it can drain out all here around the edge of the inside of the eye. So if that all gets sort of cemented down, it's sort of like putting a plate over the drain in your sink. Your drain might be okay, but the water can't get there to drain out. So this is a big risk factor for glaucoma. So when we see this, this is something we really want to monitor when we're following individuals who have pigmentary uveitis. And one of the things that we'll do sometimes as part of their treatment is prescribe a medication called tropicamide. And that's the drug that we use to dilate their pupil, because what we're trying to do is basically on purpose move the pupil back and forth every day so that we hopefully keep it from getting stuck down, so that we don't get those adhesions, so that hopefully we can avoid problems with glaucoma. Another thing we get is this stuff we call kind of fibrinous material. It looks like cobwebs inside of the eye. So all this kind of swirly stuff that's sitting here is not supposed to be in the eye. And it looks like Spider-Man got in there and started spraying webs everywhere. And that stuff is thick and sticky, and we get a bunch of it. Behind the iris where that fluid has to flow, and it starts gumming everything together, and can be a big reason for us to get for them to develop glaucoma. So that's one of the other big risk factors, is one of the big things we're trying to watch for. And you can see, like in this eye, all this part where the pupil looks all kind of ragged and smudgy, it's all stuck here. Mm-hmm. And then this weird picture below, which hopefully I've forgotten to give my caveat warning of, I know eyeballs gross some people out. I often forget that because I find them fascinated. So my apologies, but this is an eye that has pigmentary uveitis. It had to be removed because the patient had developed the glaucoma. So we took the front covering of the eye off, the cornea. This is the iris, that colored part of the eye. And now we're peeking underneath it. Here's the lens. And then this part of the eye here that we can't really see very well during our exams is what we call the ciliary body. So when you've heard the term ciliary body cysts, this is where one of the places where the cysts, which are little like water-filled balloons, can form. And so that material gets all stuck over here. And the problem is this tissue also makes the fluid inside of the eye. So when it gets all gummed up, the fluid can't move through and can't drain. And the problem is this material doesn't really respond very well to a lot of therapies. So sometimes when we have inflammation in the eye, there's some injections we can do that break down some of the other cobwebby material that develops, but it doesn't work very well in the golden. So one of the things we're working on now is trying to figure out more about what this material is, because when we look at those slides under the microscope, the typical ways we process it dissolve the material. So we're looking at it with electron microscopy to be able to look, because if we can understand it better, we can potentially either find ways to dissolve it, which would be a huge help in treating patients with glaucoma, or we could find ways to prevent it, and it would help make more sense about what all's happening inside the eye. So this is an area we're really working on in the research, is understanding what Spider-Man is doing inside of the eye. So glaucoma, really kind of the reason most dogs with pigmentary uveitis end up losing vision is if they develop glaucoma. So glaucoma ends up being a bad deal because they lose vision, it damages their retina, but it's also painful. So people with glaucoma often say it's like having a migraine or having a horrible brow ache. So they don't usually walk around with their eyes closed, but they're usually not quite as active. I mean, they're usually not eating quite as well. I mean, they're golden, so they are quite amazing and are like, oh no, I'm still good. But usually after we get the pressures down, then it becomes more noticeable that they've quieted down. So initially, the first papers about pigmentary uveitis were really depressing and said that 50% of the dogs would end up getting glaucoma within a year of their diagnosis. And that was very typical for what we were seeing, because we were seeing them really late in the disease process. So we were seeing them after there was lots of scarring, after there was lots of the spider webs, after we had lots of the pupils stuck down, and there's not any way to reverse those changes. What we found, our more recent study, the one that we had published this fall, where we had a group of dogs that we were following, those dogs were generally all diagnosed much earlier, where there were smaller amounts of pigment and they didn't already have, you know, like in this image, they didn't already have their iris stuck down. They didn't have the cobwebby stuff in the eye. Those dogs did much better, and only 17% of them got glaucoma. And a couple of those were really severely affected at their first visit, but most of the rest of them were not, which means we're doing better if we're catching it earlier and having them be able to maintain vision throughout the rest of their life. So that, you know, that's been very encouraging. Another thing that we can see that can cause problems with vision loss is cataracts. So 30 to 40% of the dogs with pigmentary uveitis will have a cataract or an opacity in the lens. Most of them, though, are tiny and don't interfere with vision. So this dog has a cataract that's impairing vision. So it's completely white. You can't see through it. The dog can't see out. We've got lots of areas where the iris is stuck down. We've got the pigment glopped all over the front of the lens. And so the difficulty here is they're usually not very good candidates for cataract surgery, because they tend to have a lot of complications with glaucoma afterwards because of all the changes that have happened in the eye and all the scarring that's already there. But thankfully, that's really a smaller number that get cataracts that are this advanced. So glaucoma is really the area we're trying to target more, just because that's usually where we're having more painful eyes and losing more vision. So the darkening of the iris, this is a little bit of a bugaboo in that we certainly see, here's a dog, these are some cataracts here. This is a little cyst and another little cyst friend next to it. We've gotten the pigment that's on the front of the lens. And this whole iris used to be more of this orangey brown little patch here, but it's getting darker and darker. So starting to look kind of more and more like dark chocolate. And that's because this pigment that's floating around is getting stuck and sticking in the iris also. So we can see that along with the radial pigment and go, okay, yep, that's pigmentary uveitis. We have to be really careful though, unless it's a dog that, you know, we've been following, to just look at a dark iris and say that that's pigmentary uveitis 1, we need to see the radial pigment. But the problem is, and this is not the greatest picture, there are some Goldens that from the time they're born have a really dark, like, you know, dark chocolate colored iris. It tends to be ones who have the lighter coat colors. But if you looked at this dog, you know, it's almost, you know, verges on being black, but this is the color this dog's iris has always been. And I've done multiple exams on it from the time it was little, and it doesn't have cysts and it doesn't have pigmentary uveitis. So a dark eye color by itself is not, you know, that's not a basis to diagnose pigmentary uveitis. So I just throw that out because sometimes, you know, ophthalmologists will worry if they're seeing the darker color, but it's really important to, you know, watch it and see if it's changing, because there's just the variation according to the dog's coat color. So now we get to really kind of the big bugaboo, or a topic that brings up a lot of questions, which is uveal cysts. So when we look at this eye here, we've got a big giant cyst here. So they're like big fluid filled floating water balloons. And so they may still be attached, or they can float around free in the front of the eye. Here's one that's hiding behind the iris. They're kind of shy. A lot of them like to hang out there. And then we'll have other ones where they'll collapse. So I tell people, imagine you have like a sticky water balloon and you throw it at the wall, and so it sticks and collapses. If they're loose and bouncing around the eye, they can either stick on the lens and collapse, or in this one's come forward and is collapsed on the back side of the cornea. And you can see it still has kind of a stalk. It's still attached back behind the iris. It has a friend that got stuck on the lens. It's got a bunch of little friends here next to it. And you can also see kind of the variation. This one's a little darker. These are kind of lighter. So I'm going to come back to the cysts some more. We'll talk a little bit about treatment, but the cysts are a whole kind of topic unto themselves. So treatment-wise, things that we do when we diagnose pigmentary uveitis, starting topical anti-inflammatory therapy does seem to slow progression. But in looking at dogs so far, we haven't found any difference as far as which treatment we pick. So they all seem to be pretty equally effective. The key seems to be starting early. And I think part of it is we don't often see a lot of inflammation in these eyes, and eyes that get glaucoma, when they look at them under the microscope, there's not a lot of inflammation. I think they have little spurts of inflammation in the eye, and you don't know when that's going to be. So if they're getting the drop every day, you're proactively preventing that. So things we use are often either topical steroids, so prednisolone acetate, or neomycin polymix and dexamethasone. So that one can be a drop or an ointment. The prednisolone acetate's a drop. So we use those. The disadvantage with steroids, especially if we have to use them long term, is they start getting these bright white fatty deposits in their cornea that can also be a little challenging for vision. So for me personally, unless they really have tremendous amounts of inflammation, so I need to be able to have a stronger drug, I'll usually use a topical non-steroidal. So basically these are like an aspirin drop for the eye, and there's several different drugs. They all seem to be pretty equal. And with these, especially like dogs I've seen over the last couple of years, like with every other pharmaceutical, things keep going on and off the market. They're getting back ordered. So we'll have dogs that we switch from one to the other because of availability. And I haven't seen differences or big changes in the control in between times. So these I use really pretty interchangeably. It's more whichever one we can most easily access. So again, the big key here is, the early diagnosis and starting therapy early, but which medication, they're all pretty equal. Then other things that we might add, if we're having problems where we're getting the iris stuck down, then we start dilating their pupil with tropicamide. We can't use that if the pressure's starting to go up, because that can make glaucoma worse. So that's one of the things that we're monitoring as we follow up is the pressure doing okay? And then if they start having their pressures go up, we start adding in glaucoma therapy as we need it. And there's a couple of different classes of drugs that we'll use, and which one really kind of depends on how high the pressure is. One that's called latanoprost is really kind of our last line of therapy. It's really the best at dropping pressures, but the problem is this intense miosis. It means it makes the pupil really small, so like a little tiny pinhole pupil, and that can make it want to get stuck down in the eye more. So usually when I'm using that drop, it's because I'm worried the pressure is going to get so high that we're going to lose vision because of it. So that's usually kind of farther down my list as far as which one I choose. So these, your ophthalmologist is all going to adjust and choose according to what the pressures are doing and where they're reading. So then there's often a lot of questions, which is a really good question, about doing supplements and what's helpful and, you know, what potentially makes a difference. So one that we've looked at, we looked in the other paper, but we didn't have enough dogs on any one particular supplement to be able to make huge statements on whether it was helping or not. But one that we've been looking at is called OcuGlow. So it's basically an oral antioxidant therapy. So it's got omega-3 fatty acids in it. So again, that should help with diminishing inflammation. It's got lutein in it. And so lutein helps with retinal health and helps with health of the lens, can help be protective potentially to the retina when patients with glaucoma. So lots of things to like about that. Xanthine is in there as well, which does a lot of the same things as lutein. Those are medications that have been shown to help people with macular degeneration. So they certainly have been shown to be helpful for retinal health. Then grapeseed extract, because again, a powerful antioxidant, and then vitamin C and E. So the benefits, it's really well tolerated. It's quite low risk. So 2 studies in the paper where we were looking at progression, we didn't see a difference if the dogs were on OcuGlow, but our numbers of dogs that were on OcuGlow were fairly small. In another study where we're finalizing the data, we had dogs that we diagnosed initially, and for either the first month or 3 months, depending on how severely affected they were, we did our typical therapy, and then we added in OcuGlow at the same time. And then we were comparing how much they changed as far as pigment and other scarring inside the eye from that baseline to the next year while they were on the OcuGlow. And what we found was, I was hoping it would be like a slam dunk difference, but what we ended up have been finding so far is that in a year, they changed about the same as they did in the first 1 to 3 months. So it may be helpful. It may be slowing things down. Also, potentially something else people could do, because the disadvantage of OcuGlow is it gets a little more expensive, is you could also provide omega-3 fatty acids by doing things like feeding a fish oil supplement, which a lot of Goldens, or at least it seems like a lot of Goldens, are already on that. So continuing that, and then you could get the Ocuvite, which is the product for people that's got the lutein and the xanthine, and you could supplement that to be able to add those antioxidants. If you're doing that, though, you have to be careful, because Ocuvite now also has like coenzyme Q for heart health, and with a multivitamin, and you know, so that it's gotten a bunch of things added. So you just want to get the plain Jane one that's just the lutein and xanthine, and that doesn't have the with a multivitamin or with heart health support or with something else like that. Then you can dose it just like they do in people. So again, something that's really safe for them to be on. So, and then the other thing with treatment when they're blind with glaucoma, you know, this is when it often gets difficult, either if they're, you know, have gotten quite a bit older, or if they've got if they're older and so they're dealing with another health condition, is what to do at this point. So at this point, you know, people are usually having to make the decision of, do they remove the eye? Do we put a prosthesis inside of the eye, so we kind of keep the shell of the eye, and then put a silicone sphere inside so they still look like they have their eyeball? Or with glaucoma, we can also do injections into the back of the eye that, once they're when they're blind that damage the tissue that produces the fluid. This, in patients that have pigmentary uveitis, we have a lower success rate, I think because the Spider-Man web is kind of coating and protecting that tissue from the drug. So it's certainly something owners can still elect to do, and it won't hurt anything, but it may not be as helpful and may not control the pressures. And so we may still end up having to discuss removing the eye. The good news is, they can do really quite well with the removal of the eye. So, there's certainly some Goldens out there who've unfortunately had both eyes have to be removed because of their glaucoma. And, they're still very happy in an environment where furniture is not rearranged. They can still do really well, but it's a really difficult decision. And it's an additional surgery for them to have to go through. So, where did pigmentary uveitis come from? We'll probably never know that, but we do know it was really kind of first identified in 1996. So before that, like going back through some of the old newsletters, it was getting noticed that there were golden retrievers and they were having, this inflammation and all of that cobwebby stuff being deposited in their eyes, and people were going, what is going on? So it first was noted in the Surf Genetics book in 1996. The first publication came out about it in 2000, and then it got reported on the Surf forums in 2001. So it makes it challenging, trying to look back through pedigrees, only because before that it's not going to be listed. So a dog could have had pigmentary uveitis, but it wasn't recognized as an inherited condition. So, it's pigmentary uveitis is not going to show up on the form. So that makes it, a little difficult trying to trace farther back in pedigrees. So the breeding advice for dogs that are affected with pigmentary uveitis, they don't pass the OFA exam. And the reason is because of the risk of producing dogs with painful blind eyes. So that's why they're not going to pass if they have pigmentary uveitis. Even if it's really mild, they don't pass their exam. Because sometimes people have had questions, and if they're marked as having pigmentary uveitis, they don't pass. And prevalence-wise, per the OFA exams from 2015 to 2019, it was 1.3% of the dogs. So fairly low numbers. Some of the limitations, if we try and look backwards, it wasn't recorded before 2001. And then something that tends to skew the exams is usually it's more younger dogs that are getting the OFA exam. So, when we look at the population, it's not an even cross section. And if they're two, they're not going to have it. So then we started looking back in early 2011, 2012. I was examining golden retrievers in the area where I was, so Illinois, Indiana, and Michigan, and found that 5.5% of them had pigmentary uveitis, and then almost 10% of the ones more than 10 years of age had pigmentary uveitis. And we were looking, we were going to shows and we'd gone to some breeders' houses, and I was asking to look at older dogs because I was trying to find also controls for the genetic studies. And so some people, if they had a neighbor they knew had a golden, they were like, hey, let's bring it down and let's look at it. And often, the dogs that were coming ostensibly to be controls, then we would end up diagnosing that they had pigmentary uveitis. Because again, when it's fairly early, there's not really the signs. So our current prevalence data, having looked at around 1,590 Goldens in the US and Canada over the time period I've been researching it, for all of the Goldens, it's 15.4%. So if we look at all of the ones I look at, now to be fair, age group wise, I don't usually look at dogs that are less than 2 years of age just because they don't usually have cysts in their eyes. We were initially, but their eyes usually all looked beautiful on ultrasound and everything else. So they're usually, more than 2 and going more towards older dogs. And this is where, everybody's been so great and supportive in bringing dogs for me to examine at the Golden Retriever Nationals and then clubs around the country having me come out. When we look at dogs more than 4 years old, then it's 18.5%. When we go to dogs more than 8 years old, it's 23.9%. So the older we get, the more we see it. I haven't seen any significant regional variations, and we've confirmed that looking at the OFA data. So they've sent that to me, you know, with geographic data included, and it seems to be fairly evenly distributed. So in this image, this is unpublished data for a paper that we're working on currently. So on this side, we're looking at the percentage of the dogs. And then here we're looking at the age. And if they're blue, then it meant when we did their exam, we didn't see pigmentary uveitis. And then if it's red, that we did diagnose them as being PU affected. So what you can see is the older you get, the more dogs that you're going to have who are affected with pigmentary uveitis. So, you know, 0, 1, 2, they're not going to have pigmentary uveitis. 3, it's going to be pretty rare. 4, again, not very many. These are always concerning because if they're affected that young, the chance I'm going to be able to keep them, or whoever their ophthalmologist is going to be able to keep them visual if they live to be 12 or 13 is not going to be very good, just because that's a long time to keep going and have them avoid glaucoma. And then again, as we get out, you know, 8, 9, 10, then we're getting to about the 25%. So now we come back to our friends, the cysts. And one question I get a lot of is a uveal cyst different than an iris cyst, different than a ciliary body cyst? You know, my dog got diagnosed with having an iris cyst. Is that different? So the uvea is our term for the layer of the eye that's the blood supply. So it's made up of the iris, which is this part right here, the ciliary body, that part that sits right behind it, and then the choroid, so this layer in the back of the eye. So this, when we talk about the uveal triangle, it's our big generic term for all of those parts. An iris cyst would mean that we knew it came from the back of the iris, versus a ciliary body cyst saying we knew it came from the ciliary body. Unless we're looking on the ultrasound, we can't really tell exactly which of these pieces of tissue the cyst came from. So these terms really, people will use different ones, but really we should think of them all as being pretty interchangeable, because again, unless I'm looking on the ultrasound, I don't know for sure that the cyst came off the ciliary body. If it's floating up here in the front part of the eye because it came loose, then I don't know which piece it formed off of. So I want you to think of those all as being synonyms. So again, uveal cyst, iris cyst, ciliary body cyst. These cysts here, so we have a bunch of these are behind the pupil, and then this one's floating free in the front of the eye, or over here we have this whole cluster of cysts. These, depending on who looks at them, could be called a uveal cyst, could be called an iris cyst, could be called a ciliary body cyst. So those are terms that really get used pretty interchangeably. So that's kind of one thing with the cysts. Then, okay, so my golden has cysts, like what does that mean? What am I supposed to do with that? Are some better than others? Is it better if they're in one place than another? Is one number better than another? So to look again, here's an eye that's cut in cross section now that's looking up at the top of the screen. So here's the cornea again. Here's the iris. Here's the lens. So this is that ciliary body, and all these little kind of blobs coming off of it here, these little circles, are all cysts that are forming on the ciliary body here. These are tricky because they're small enough that a lot of times these guys we can't see on our exam. We see them when they're bigger and coming up closer to the edge of the pupil. So per OFA data, if we look overall at all of the various cysts, it's the most recent numbers are about 8.4% if we average the last couple of years together. With the group, with the 1,590 Goldens that I looked at, 33% of them had a cyst that I could see doing a dilated eye exam. So here we've got, this dog's got, 1, 2, 3, 4, 5, 6, 7. So it's got multiple cysts here. In the mean age, when we looked at the dogs that had cysts, they'll tend to have them, here was 6.8 years of age. So around 6 tends to be when a lot of the cysts start showing up on their exam. And one thing to note, and then I'll show more of the cyst data, is these things, again, can collapse or they can deflate. So if you think of a balloon sitting there, it can either explode or it can deflate over time. So the next time we look at this dog, it may or may not have the same number of cysts. So if they deflate, then sometimes we can't see them, or it might have collapsed and be stuck on the front of the lens. So the collapsing ones, if they're just sort of if they're deflating, that doesn't seem to be as much of a problem. When they're collapsing and sort of exploding and sticking on additional tissue, that can start, again, kind of blocking the flow of fluid and start sticking things together in the eye and can be more problematic. So we had asked, Kathy actually had asked OFA to look and give us more defined details on the cysts that they were seeing. So from 2012 to 2019, we didn't count 2020 because the numbers are way off just because so many clinics weren't held. So we've got single cysts, multiple cysts, and then free-floating cysts, the total number of Goldens they looked at, what percentage had cysts, and then here's their average age in month. So in the percent, I didn't count the dogs that had the free-floating cysts because most of those dogs also had multiple cysts noted. So it would have kind of been double counting on some of them. So you can see here, 5.3, 4.2, it looks like numbers are maybe going down. Age-wise, I thought this was encouraging that the average age is increasing because that means, people are getting the message and older Goldens are getting examined, which is great. So that, again, we'll find out, be able to detect pigmentary uveitis and know more about the status of those individuals. So with the cysts, the types often get talked about a lot. So we can describe them by location, number, and whether they're free floating or not. So the location, the most common place to see them is tucked in behind the iris on the side of the eye towards the nose. Like that's where we're going to see most of the cysts starting. And then they may start extending and going more around the pupil. So we could have one that's hidden in behind the iris. We could have multiple, like this dog here, and we can have the free floating cysts. Here's one that was free floating and then collapsed on the lens. So a paper had come out of Canada and they had described dogs with thin-walled cysts. So in this image here, this is what they would call a thin-walled cyst. So it's not super dark brown. That 56% of those went on to develop pigmentary uveitis, so that it did seem to be a risk factor. But if you had a thick-walled cyst that was free in the front of the eye, that none of those developed pigmentary uveitis. Well, one thing that's a little problematic with that is I don't see a whole lot of golden retrievers that just have one single free-floating cyst. They'll often be more like this dog where we've got multiple cysts and then a free-floating cyst sitting here in the eye, which follows with what was on the surf data, that most of the dogs who had free-floating cysts also had multiple cysts. So we don't often see them occurring as like an individual separate entity. There's often other cysts present. So because people often say, well, it was just a free-floating cyst. I think we have to be careful in the Goldens because a lot of them have other cysts. And so again, looking at that cyst data, it had all of the diagnoses for each dog listed next to it. And so looking at like dogs with single cysts, there were dogs that had a single cyst and also that was visible and also had pigmentary uveitis. And same thing with multiple cysts. Those dogs had pigmentary uveitis, and the same thing with the free-floating cysts having pigmentary uveitis. So again, the free-floating cysts can still be problematic and can indicate the potential for an increased risk for pigmentary uveitis. So looking at how many of those are going to progress and develop pigmentary uveitis, this shows some more kind of hiding back behind the iris. So in dogs that I had followed, if they had no cyst or just one cyst, some of those got pigmentary uveitis. We followed them for 2 years, but it was 3% of them. So it was low. So if you had a single cyst or no cysts, you were about equal for your risk. You were equal for your risk factors. And part of that reason is, again, if the cyst deflates, maybe you had one and then the next time we did the exam, we didn't see it. Or maybe you'd had one the year before and at the time we did the exam, we couldn't see the cyst. If you had multiple cysts though, 44% of those had pigmentary uveitis at the recheck. So that significantly increases the risk for pigmentary uveitis. So dogs that have multiple cysts need to be watched more closely. So looking at the new data, the larger number of dogs that we'd followed, again, 40% of those with the cyst went on and got pigmentary uveitis. It's often kind of 2 to 3 years from the cyst, when the cysts are noted, to the diagnosis. And we note cysts in high frequency and pedigrees with pigmentary uveitis. So they're definitely a risk factor. Exactly how they tie in, we're still trying to figure out the genetics behind it, but a dog with multiple cysts like this is one that we're going to be very worried about. So not every dog with cysts is going to get pigmentary uveitis. So if they have multiple cysts, then instead of monitoring them yearly, I'll start checking them every 6 months again, so we can try and be proactive, be watching, and we'll consider starting topical anti-inflammatory therapy, trying to potentially ward off development of pigmentary uveitis, but I'm always very careful to tell owners, if they don't get it, I don't know whether it was because of the drops or whether they just were a dog that was going to have cysts and not ever get pigmentary uveitis. So that tends to be kind of the approach we take when there's multiples. So what do you do if you have a dog with cysts as far as breeding? So they pass OFA as a breeder option. On the form, we can mark them as single, multiple, or free floating. I caution people, if there's a history of pigmentary uveitis in the siblings or the parents and they have cysts, I would try and wait on breeding that dog. I would be concerned or more cautious about what could happen, and certainly avoid, if you've got a dog with cysts, avoid lines with pigmentary uveitis or dogs that also have a lot of cysts, because I think we're going to increase our risk of developing the condition. OFA, this had come up in the discussions preparing for this talk, and I talked to OFA, and the ACVO Genetics Committee did too. They're going to work on changing the OFA certificate so that dogs with cysts, it will show whether they had single, multiple, or a free-floating cyst in the eye. So there'll be more detail as people are looking. So it'll come with an extra code that'll note whether it was how many they had. So like this dog had multiple in one eye and a single free-floating cyst in the other eye. So now people will have more details as they're trying to look into pedigrees. And then as we look at cysts, when we look at the percentage of dogs here and pigmentary uveitis clear and then clear with cysts, you can see, we tend to see a lot of cysts, but you can still be clear and have cysts. Kind of the older you get, the number tends to drop down just because more of those dogs tend to develop pigmentary uveitis. So then the ultrasound exams we do, that's to help us look at the ciliary body. That part I can't see very well during the exam. So here's a bunch of cysts sitting here. They're all too tiny. I couldn't see those on my exam. But on the ultrasound, here's the iris and ciliary body. I can see the cysts in that area. So this is a dog with multiple cysts. This is a dog who's got pigmentary uveitis. So it's starting to, it looks like a bunch of grapes and the wall's a little thicker because it's getting the cobwebs wrapped around it, but they look quite similar. So when we look with the ultrasound, I find a lot more cysts. So now we're up to more like 70% of dogs who have cysts, and the multiple cysts and the pigmentary uveitis look really similar. So we don't find a lot of dogs that don't have cysts. So 70% of the Goldens. The thing that gets a little tricky is we also, from doing the research, can see it as an aging change across all of the breeds. So we do always see it when they have pigmentary uveitis. If we look on ultrasound, we always see those cysts. But it's not really turned out to be a very good screening tool. Again, because the older dogs, we can't sort out the aging cysts that we can only pick up on ultrasound from the cysts that are there because of, a risk for pigmentary uveitis. So that is not really a good screening tool. It's been a helpful research tool, But that's why we're not recommending everybody have ultrasound exams on their eye as a screening tool. Because again, percentage of dogs, the ones that have no cysts, and then the ones that are clear with cysts, you can see there's lots and lots of cysts. This year, where it looks like there's a big difference, there weren't very many dogs that we looked at. So that's kind of why that data is skewed. There was only a couple 15-year-olds. So this was just the paper where we were looking. If we're going to look for cysts, we've got to use the ultrasound biomicroscopy, so that high resolution, really high detailed imaging. And this is also where we found out that old dogs across all breeds starting to get cysts. Those beautiful little folded pleats, just like everything else as we get older, start to get a little saggy and baggy, and then we start seeing the cysts as those layers start to separate. So heritability of pigmentary uveitis, and this is where I hope I make Dr. Eckenstedt proud and don't mix up some of the stuff. So, because this is all her area. But what we find, it has a moderate to high heritability, and I've got another table that shows more, and it's predicted to be polygenic. So we've looked doing genome-wide array studies, so looking for markers to try and see, is there a specific area that shows up with dogs with pigmentary uveitis? And I've looked at a lot of dogs now and don't see a difference between our controls and from the dogs that are affected. So we think we've got multiple genes that are playing a role. So the study out of Canada, they had looked and constructed a pedigree and had suggested that it was autosomal dominant with partial penetrance, so meaning that it didn't always completely affect, that there could be changes in it, but a polygenic model, meaning a couple of different genes are causing the problem, would fit that pedigree also. So one of the things Dr. Eckenstedt has recently done for us with one of the postdocs in her lab is using the supercomputers at Purdue, put in both the pedigree data and then all of the genotype data that we have. So all of those different SNPs. So there's like 170,000 or more of those for each dog. And then we've got 100 and some dogs that are getting put in. So it takes supercomputers to crunch all the numbers through all the algorithms to look at and compare and say, okay, how heritable does it look? So at first, when we've been looking with the pedigrees, so 0 means it's not inherited at all, and then 1 means it's strictly a genetic trait. So looking at just the pedigrees, the red is the cyst of this pigmentary uveitis, and it's almost 1. So that looks very heritable, and was the reason we initially thought, oh, it looks like it should be, 1 gene. And then the cysts were lower. Looking either at the genotypes, so all of the sequencing or all of the data we have from all the different SNPs together, and either that alone or combining it with pedigrees, and either looking at just dogs from North America, or we don't see it in the dogs from the UK, so we got genotype data from them as well and incorporated it. And now the heritability, it runs from like 68 to 76%. So that still says it's a highly heritable trait, that genetics are playing 3/4 of the role, but there may be some additional environmental factor or other factor that's playing a role, or that's interacting with the genes to cause the changes in its expression, or to make it be expressed. But this also says that there's several genes that are involved. So we could be looking at a situation like they have for Ciliary anomaly. And with that, what they found is there's sort of a spectrum of things that those dogs present with. They've found so far 1 gene, and it explains all the time one of the traits that they get. And it has to be there to see the other traits evolve, to see the other traits show up. But there's another gene at least, or more, that are out there that control whether the other condition shows up. So it may be that we're dealing with that sort of situation, or hopefully not to this extreme, but the idea of like hip dysplasia, where you've got multiple different things and then environment is playing a role. So this heritability data, which was calculated using multiple different methods, and a lot of these get used for livestock. So they're looking at, like, cattle and looking for projection traits, and usually they're putting tens of thousands of dogs in, or tens of thousands of individuals into the model. Our numbers are lower, so the genotype data we have is around 150, 160 dogs that's being put in. So big for, good numbers for a canine study, but nothing compared to what, often gets put into these formulas. So that may be, also contributing to a little variability here. And then with the cysts, part of the difficulty there may be the fact that depending on when we look and how we're looking, we can't always see all of them. So those are all, like when we do the UBM, the ultrasound exams, we can't necessarily see every bit of the entire eye. So there's cysts that we could miss. But it does say that genetics are a big portion of pigmentary uveitis. So trying to look for other factors influencing, we haven't seen any obvious increased risk of cancer, because people have asked about that. And so we don't see differences or see more cancer or less cancer in the dogs with pigmentary uveitis. We haven't found a defined environmental factor that we could point to at this point. Certainly, we don't see regional differences at this point, and we don't have any known infectious component. Saying that, one of the things that we're at a point we can start looking at is the dogs in the Morris study are now getting old enough to be in an age group where they start developing pigmentary uveitis. So we can start looking, because of all the fantastic data that's there, we can start looking again to try and tease out and make sure there's not a factor we've not been aware of. So that's one of the things we're going to be looking at now that we've got enough age here. And so the current research, we're trying to determine the genetic basis. So we're looking at sequencing more dogs, and then also now looking at RNA expression. So looking at the, what the genes are doing, because that can sometimes be a way to track down and locate where it is that we've got where we've gotten the mutation or where we have the changes. And then also looking at all of the SNP data we have, so that maybe while we don't yet know which genes are involved, we may see combinations of SNPs that are predictive that they're going to develop pigmentary uveitis, so that we could put that data together and develop a risk score. So a little bit along the lines of kind of the risk factors, or some of the things they've looked at, trying to look at for dogs with hip dysplasia. So here, trying to look genetically to see if we can predict a risk score until we can find the particular genes that are affected. Looking at that cobweb material so we can understand, how we can treat it better, how we can try and prevent that, because that's what causes a lot of the damage. And if we know where it's coming from, that can help us also aim at, genes that might be involved. And then using the Morris study data to examine for the other risk factors now that they're getting old enough. So to be able to look through there. So for people had asked, like, where they've sent the eyes in for us to look at, we've used those for a couple of things. That's been a tremendous resource, and we're using those both to try and look at that cobweb material in the eyes. We've also used that to try and characterize dogs who would make really good controls for the genetic studies too. So that's a lot of what we've looked at there and how that's been really helpful. So these are the VetVine presentations. So again, they put those in the chat, and thank you to VetVine and the AKC Canine Health Foundation for those. So it's a great resource to send out to your vets. And thank you so much to the Golden Retriever Foundation and the AKC Canine Health Foundation for the grants that we've had. The GRCA, the Canadian Golden Retriever Club, and Purdue Vet Med. So really appreciate things and hope that's helped answer some of the questions, and then happy to answer any other questions that come up. And I'll stop sharing the screen.